Welcome back to Your Health Matters. I'm Jamie Taylor, and my guest today is Joe Stevens, the case manager with KRMC's Cancer Center. Welcome back to the show, Joe.
Thank you, Jamie.
It's good to have you. We were talking earlier about the full range of services that our Cancer Center provides, both from the radiation to oncology to hematology. And then we have a brand new oncologist, Dr. Nagel, who has just joined us. Want to share a little bit more about her? I know you've been excited having her on the team.
I really have been. Dr. Nager is our permanent doctor.
Right.
And I think the biggest thing about her being here, she's very community oriented, likes to involve the community, very patient centered, is an excellent communicator, and she's just a fantastic doctor. I think, again, we're fortunate and very welcome to have her here. As you had mentioned, she may be up on an upcoming show, and I really want, if you can, everyone to catch that one, because I think everyone will be impressed to hear what she has to say. Very
good. Well, we were talking too about your role as the patient advocate and how you pretty much, from the time they first get their diagnosis and come into the first time to meet with the doctor, and then all the way through their treatment, and that can go on for weeks, months, maybe, right?
Months and even sometimes years.
Wow.
Really, you have diagnosis, treatment, and then beyond. And some people whose cancer is in remission, there's still a lot of questions that they have. Like, for example, okay, I'm not getting treatment anymore, cancer's in remission. How do I eat? How do I reduce stress? What do I do different in my life? My priorities have changed because of this. Where do I want to focus? So a lot of questions come up, and so I even follow them through, in most cases up to a year, just to help them deal and or refer to whatever services that they might need.
Back on the right path again.
A lot of questions after completing treatment.
You had you touched on the nutrition and the fact that we have a registered dietitian on staff that's there to help answer their questions, because I'm sure when they're first going through treatment, obviously they're having a hard time keeping food down maybe and things like that, so they need special help then, making sure they're getting enough nutrients to help fight, right?
Yes, again, like you had said, the strong suit about the hospital here is that we provide a team. And KRMC has a whole team at the Cancer Center, and the dietitian also follows you through treatment, especially if it's chemo. That may change your eating habits. She's always there with all these, she's a very neat person, always there with all these kind of different recipes and things to try. And I think, you just get a lot of concerned people that come from different perspectives to try to maintain some some self-esteem and some good feeling about yourself through this kind of uncomfortable time.
Right, and that's a challenge. And like you're talking about with the aftercare too, and that positive attitude that can so majorly impact your recovery and how you continue on. And there's support groups as well, right?
Yes, I do a support group in the community, first Tuesday of the month here at the Wellness Center.
At the Wellness Center? Okay.
Yes, at 2 o'clock, and that's for patients who are currently going through treatment and or have finished treatment. And then the fourth Tuesday of the month at 2 o'clock here, I do a caregivers group.
Okay.
And that's open to the community.
Okay. So I would imagine caregivers have a whole unique challenge.
They definitely do. Actually, it's very stressful, very intense, and they deal with just as much feelings and stress that sometimes the patient does. It's a very critical position, and takes very needy and sometimes in what they need.
Kind of high maintenance, as they say. But I know for myself, I have seen in my own life and in others how having a support system or a support group that you can go to that allows you to talk about your feelings and realize that you're not the only one going through what you're experiencing right then. I mean, everybody's situation obviously is unique, but to know that other people have had to deal with similar, you can bounce ideas off each other and learn from each other. I'm sure that helps.
Yeah, it's very critical. Outside of the attitude, the support is the next biggest piece. With the attitude and the support, and people have different levels and different ways of the support, but that's really critical in maintaining feeling good about and coping with and dealing with the stresses that may come up during diagnosis and treatment and beyond.
Right.
So those are two really critical issues, and we provide that from the day they walk in the door.
That's awesome. Yeah, and I know, I mean, I just myself, having just walked over to the cancer center, how everyone there, from the receptionist all the way through, they're part of the team. They know their patients, you know, on a first name basis. They come to know them very well, and they're all fighting together to beat this. And
That's true.
and I think that's a huge thing. And of course, we all know that, I mean, Kingman has a high cancer level. You know, we don't really, you know, there's all kinds of suppositions on what could be causing that, but I think pretty much everybody in Kingman knows at least one person who's, you know, had a cancer diagnosis. So again, as we said earlier, it's good to know that we have this resource here in Kingman that will help in that battle. You had touched briefly too earlier, we talked about resources, and I know transportation, especially for those individuals who live way outside of town, like Dolan Springs and Meadview, Peach Springs. I mean, those are all areas that KRMC reaches out to. So what kind of resources are available for those folks?
Well, right now, the big plus for us is the hospital has acquired a DOT bus, and we utilize that through a driver who's employed here to pick up patients in all the outlying areas to get them there for treatment. Transportation in this area can be very difficult for some folks, and it's really a blessing actually to have that kind of transportation
Well,
available.
with the price of gas, people can't even afford to put gas in their cars if they have a car. If they're lucky enough to have a car.
But again, and part of the role is for me is that transportation piece, is developing it, maintaining it, making sure we have different resources, and it's just a fantastic service that KRMC provides in helping, you know, get people here for what they need.
Right. Well, I have to admit, I'm very proud of KRMC, and I tell people that all the time, both on the show and in person, that, you know, it's, to me, is amazing to work for a facility like this that is so compassionate and caring, and that is truly dedicated to serving the people of its community. And we've talked about how, because we're not for profit and we're able, then we don't have shareholders, we're able to take those monies and put them back into the facility, which allows us to have state-of-the-art technology that a lot of other hospitals don't have, as well as support the community. So for those ancillary type of programs and services, and being able to support the cancer care unit, and to make sure they have the funds they need to be able to help the patients, and ACS with their programs. And so there's just, it is, I mean, the community, I think, gets behind people, you know, they really do, and they help each other, so that's really important. If somebody has questions, Joe, and they, you know, or they've been watching this program, and they maybe have a family member, or they, you know someone, or they just have some questions, who would they call? Can you answer?
Well, you can call the Cancer Center, 928-692-4665.
4665, okay.
And my extension is 5678, and part of my role is I do everything from tours to answer any questions or concerns, or when people travel through and they're thinking about moving to Kingman but may need services at the Cancer Center. I'm more than happy to help them with that.
I forgot about the tour side of it. That's a good thing too. So if someone's just curious to see, I mean, obviously nobody plans on getting cancer.
Right.
We hope that they don't ever have to use that, but it is good that they know what's available for them if that day ever comes, for them or a loved one.
If anybody is diagnosed or a loved one's diagnosed, first thing they can do is give me a call.
Okay.
And we'll talk about what services we have. They can look at it, weigh it out themselves, see what they think, but I think they'll see that KRMC does an outstanding job.
Right, and so you could give them a little tour and show them around. And I know on our website as well, we've talked about that on other shows, it's the azkrmc.com that people can go to, and there's all kinds of information there about the different services and programs that we offer. And Dr. Nagel's picture's on there now under Find a Physician, so they could check that out and find out more about her background. And I'm sure if they come in for a tour, and if she's available, that she'll say hi to them as well, right?
She will. She's very engaging.
That's good. Yeah, I know. As I said, I brag about KRMC all the time. I am very proud and proud to work with people like yourself, Joe.
Oh, well, thank you very much.
That's good. Is there anything else you want to share while we've got a minute left?
Well, I think we summed it all up. I think you know, I do want to reiterate the counseling part. Some people don't always know where to go with that, and I do want to just say that sometimes I can provide that service too. And just to let folks know that I as far as credentials, I do have a master's degree in clinical social work, licensed in the state of Arizona as a therapist, and I'm also certified in oncology.
Very good. So you know what you're talking about. Very good. Well, Joe, thank you again for being on the show. We thank you for joining us today. If you have any questions, give Joe a call, but we hope you'll join us again next week for Your Health Matters.